Today's markup is yet another important opportunity for our committee to advance legislation that supports the most vulnerable Americans by reauthorizing key programs to combat substance use disorder and safeguarding seniors' access to prescription drugs. We reaffirm our commitment to strengthening our healthcare system and expanding access to care for patients and their families. Last Congress, each of the 6 bills being considered today advanced through this committee unanimously and passed the House with strong bipartisan support. Our members devoted countless hours collaborating with healthcare providers, policy experts, and patients to develop these pieces of bipartisan legislation, and I look forward to moving all of them forward once again. The Support Act for Patients and Communities Reauthorization Act, which I am co-leading with Congresswoman Pedersen, has received widespread support from over 160 vital substance use disorder treatment and recovery organizations, as well as patient-provider advocacy groups. This legislation reauthorizes key public support programs focused on prevention, treatment, and recovery for patients with substance use disorder that were established in the original Support Act, which was signed into law in 2018. Similarly, the SOAR to Health and Wellness Act, led by Representatives Carter and Cohen, will continue vital resources so local communities can help support individuals who have experienced trafficking. Another important measure, the Charlotte Woodward, wave your hand, welcome. Welcome back, I should say. You sat through the long markup the other day. We're glad to have you back and have this move forward today. So thank you for your patience and your persistence. We really appreciate you very, very much. So this has been, the bill that you're here to support is led by Representatives Kamek, Dingell, Issa, Wasserman Schultz, and ensures access to life-saving care by preventing discrimination against individuals with disabilities, including Down syndrome, with the organ transplant system. The Chandra Izinga Act, Human Cell and Tissue Product Safety Act, led by Representatives Molinar and Dingell, will support provider and patient education awareness, as well as strengthen standards and oversight related to tissue transplants to prevent future outbreaks and preventable tragedies. In addition, the Women and Lung Cancer Research and Preventive Service Act aims to accelerate research, improve early detection methods, and expand access to preventive services to address the rising rates of lung cancer. Lastly, the Seniors Access to Critical Medications Act, led by Representative Harshbarger and Wasserman Schultz, increases access to care by allowing Medicare beneficiaries to receive their prescriptions either by mail or by having a family member or caregiver pick up the medication on their behalf. All of these bills reflect our commitment to improving Americans' health, protecting the most vulnerable, and strengthening our healthcare system. I'm grateful today to all of my colleagues who have supported this legislation. Thank you for all your hard work, and I look forward to advancing these important bills out of committee. I will now